I was always interested in anatomy, the human body, especially the musculoskeletal and neurologic systems. I specialize in spine medicine, which is non-surgical treatment of spine-related issues. The most common complaint we see is low back pain, but patients may also have neck or mid-back pain, and then associated with those there may be radiating pain into the arms or legs. There are some patients that might have weakness or numbness, which can sometimes be something more significant. I prefer to see patients in person at least the first time. I do virtual visits as well, but usually for follow-ups. And so try to use what the patient tells me, and as well as their exam, to try to figure out what I think is going on. If they have any imaging, we'll obviously incorporate that into the opinion. And then I try to formulate a treatment plan with the patient. I believe in allowing the patient to help guide the care, so I sort of lay out the options, things I think that could potentially be beneficial for them, and then we try to make a joint decision based on that, how we should proceed. So I perform procedures for the spine primarily, some peripheral joints like hips, knees, shoulders, but the spinal injections are all X-ray guided that I do. Most commonly the lumbar spine, so low back, but also the neck, sometimes the mid-back. Typically common things that people have heard of, like epidural injections, which are steroid injections to try to treat nerve pain related to the spine. When you have a patient come back who has had a great response to treatment, regardless of what that treatment is, and they're explaining to you how happy they are and grateful they are to be able to be in less pain or be more active, that's pretty much what we're looking for. When I'm not seeing patients, I'm home with my family, and that pretty much takes up the entire rest of my time.